Susan Wilburn. I'm the Sustainability Director for the Global Green and Healthy Hospitals Network and want to welcome you to this webinar on climate smart healthcare, low carbon and resilient strategies for the health sector. This is a webinar about the new report recently published from the World Bank on the subject of climate smart healthcare. I'm going to introduce the Global Green and Healthy Hospitals and the speakers and look forward to this session with you today. Next slide. The Global Green and Healthy Hospitals is an international network of hospitals, healthcare facilities, health systems, and health organizations whose members are all dedicated to reducing their environmental footprint while promoting public health and environmental health. We have a 10-goal framework, and you can see on screen those 10 goals in our framework that are interconnected and all related to climate smart healthcare, including leadership, chemicals, waste, energy, water, transportation, food, pharmaceuticals, buildings, and purchasing. The next slide shows the map of the world where we have members. As of June this year, we have over 25,000 hospitals and health centers in 48 countries that are working together through the Global Green and Healthy Hospitals Network. There are a number of programs and benefits. Next slide. And I'm going to run through them quickly so that we can get to the webinar itself. We have guidance documents that provide an overview and a perspective of each goal with action items and checklists. There are webinars such as this one, and you can see on the slide the number of webinars and the topics over the past year. All of these you can also find on our website, our YouTube website, as well as greenhospitals.net. There are case studies where member hospitals describe how they have successfully implemented one of the 10 or more goals. And we have other benefits such as the award structure, the 2020 Healthcare Climate Challenge Awards that many of you have participated in, and some of you received last year in Morocco during the Committee of the Parties about climate negotiations. Next slide. GGHH Connect is our social media platform and serves as the connective tissue for all the hospitals and organizations on the network. We have 10 communities set up for each of the goal areas with experts and an interactive discussion group so you can get your questions answered. Next slide. The Hippocrates Data Center is the tool by which our members can monitor, track, and measure their progress on goals. Next. And now I want to introduce the speakers for the webinar. We are delighted to have with us today Timothy Bouley from the World Bank Group. Timothy is a global health and environmental specialist at the World Bank. He founded and currently leads the climate and health portfolio, working across bank sector and region. He also works on the bank lending programs that address ocean and fisheries science, infectious disease, satellite remote sensing and Earth observation, data science, and the non-health dimensions of climate change. Trained as a medical doctor and environmental scientist, he has in recent years worked to develop the Global Partnership for Oceans with the Nuclear and Radiation Studies Board of the U.S. National Academy of Sciences, with the World Health Organization's Climate Change and Health Cluster, and in health systems in India and Rwanda. He holds degrees in biology, bioethics, geography, and medicine from Tufts, Harvard, Oxford, and Duke. In just a minute, I will welcome Timothy after I introduce the next two speakers. Josh Karliner is the International Director for Program and Strategy for Healthcare Without Harm. Josh works to support the development of Healthcare Without Harm's work in Asia, Europe, Africa, and Latin America throughout the world, while overseeing the organization's global campaign on climate change, the development of the Global Green and Healthy Hospitals Network, and Healthcare Without Harm's collaborations with WHO, with the UN Environment and the UN Development Program. He has over 25 years of experience working on international environmental and human rights issues and is the author of this report from the World Bank, as well as a number of books in a wide variety of academic and popular publications on global environmental politics. I will be the third speaker. I'm Susan Wilburn and the Director for Global Projects for Healthcare Without Harm. And in this role, I manage our work together with UNDP and WHO in 4 African countries on healthcare waste management and mercury elimination, as well as the project together with UNDP on sustainable procurement in the health sector. Prior to joining Healthcare Without Harm, I worked for 8 years as a technical officer at the World Health Organization headquarters in Geneva, and look forward to sharing with you the case study illustrations for climate smart healthcare. Thank you all for joining us, and now I'd like to turn it over to Timothy Bouley. We're really happy to have you with us. Thanks. Over to you.
Great. Thank you so much. Really appreciate that very lovely introduction, and provided a good basis and sounding for everything that we're doing here. I'd like to just quickly mention that this work that we're doing and that we'll be talking about today is focused on climate change and health. But this is part of a much broader conversation that we're having here at the bank and internationally about planetary health and One Health and environmental health and conservation medicine and whatever you want to call it, but about the confluence of the environment and health factors. The climate change and health work is really just one part of that, albeit a very important one. So without further ado, we'll dive right in. What I'm going to do today is talk mostly about why climate change and health, why are we thinking about these things, and then what is the World Bank doing in concert with international organizations, and then pitch this over to Josh, who will go into a much further in-depth discussion of what's going on and what's in this report. So, first slide. This Paris Agreement, November 2016, really critical. So this is the paragraph about humans. This is the justification for this work. If you care about people, you should care about climate change because of human rights, communities, children, persons with disabilities, and because of health. This is really why we're here. There are other paragraphs that talk about the environment and more specifically oceans or biodiversity or natural systems, and many paragraphs that talk about institutions and finance and commitments. But this, in my opinion, is the focus of this effort: humans, human well-being, and human health. An inclusion of this is a great testament to the lobbying efforts and convening efforts of WHO and civil society groups like Healthcare Without Harm. Civil society has really been a leader in the international integration of climate change and health for the past 2 decades, producing literature and translating research into policy, connecting the dots with the environmental community, including the UNFCCC. So I think we owe a great debt of gratitude to all of those folks who have been a part of these efforts. So I can't thank you enough for that. And as a result, health, and not just humanity, is represented in the International Climate Treaty. In this, slight as it may seem, it's just a few words, but will enable the international community to come together around climate change and health and act to both secure our environmental futures and to fundamentally secure health. So what are we talking about? There are many different ways to articulate the relationship between health and climate change, and you will have seen these schematics. This is one that came out of the Lancet study a couple of years ago, and then this next one is the one out of UNFCCC. There's infectious disease impacts, there's allergens, there's water and air pollution, all of these different things, mental stress, food production issues. But the point I'm trying to make with this is that healthcare and health systems really lie right at the heart because they provide the infrastructure for solutions, for building resilience, for adaptation, and establishing the mechanisms to prevent, prepare, and respond to these increased threats. But health systems also require energy. They're built out of brick and mortar. They rely on transport and fossil fuels. And so they're also fundamentally part of the problem. And so if we're to truly think about the causes and solutions together, we need to think about how health systems can reduce environmental and climate impact while being redesigned or retrofitted to be more responsive to this new era of climate reality. So what am I doing here? Oh, great. The automations work today. So I work for the World Bank, which is the largest, more or less, multilateral development bank. We lend on and grant about $50 to $70 billion a year in loans and grants to the developing world. This goes to all sorts of things: agriculture, infrastructure, energy, transport, financial systems, governance, health. Some of it goes to government, some of it goes to the private sector working with governments, but it all goes to developing countries to alleviate poverty and build shared prosperity. But this is really just one part of the broader development landscape. There are many multilateral development banks. There's the EIB, IDB, ADB, AFDB, all of these organizations, which collectively represent some hundreds of billions of dollars in development aid. And then there are also the overseas development agencies, the bilateral agencies of countries which provide aid and lending and so on. It's also important to note that there's significant money that's been earmarked for climate change. 2015, that was about $81 billion committed for climate finance, which simply means financial resources that deliver mitigation and adaptation co-benefits to developing countries. $81 billion of these hundreds of billions of dollars for climate interventions. So all of this is to say that there are considerable resources available for funding development interventions, and more specifically, climate-sensitive development interventions. But where is health? Unfortunately, at the moment, it's really only an afterthought. There are tens of billions of dollars going to health as well, but not to health and climate. And folks thinking about climate finance aren't thinking about health, while people thinking about health aren't really thinking about climate. I can only tell you from personal experience here at the World Bank, where last year only 0.1% of health investments had anything to do with climate or climate investments. And there are only a few small projects that are trying to link this together, some of what I'm working on, and we'll go into more detail here in just a few moments. And so fundamentally, this isn't good enough. If we're to make the best, smartest, most targeted investments, we really need to think quickly about how health, climate, and development work together. So how do we do that? Well, we identify entry points. The first, because we're a bank, is finance and economics. Secondly, we're a development institution, and so we can be thinking about development indicators, one of which is health. And then third, we think about country engagement, because those are our primary clients. So on finance and economics, there are numbers out there that justify investment. And true, the numbers aren't as robust as they could be, and they are dreadfully lacking in some areas like climate and health benefits. I don't know if Andy Haynes is on the line, but he's a real proponent of this work, as are many others. The numbers really just need to be better. But there are some studies that highlight the economic imperative action for health and climate. So this first number here, the direct damage costs to health, is estimated to be between $2 and $4 billion a year, though another study placed that figure even higher at $4 to $12 billion. And this doesn't even include major disasters. A separate study estimates that climate-related disasters have already caused about $14 billion in health-related costs over a mere 10-year period in the U.S. alone. Another study suggests that impacts associated with labor productivity losses due to excess heat, correlating to heat stress, cardiovascular issues, and so on, may be as much as 11 to 20% in certain heat-prone regions of the world, such as Asia and the Caribbean. But if those numbers aren't big enough, I've got others for you. The economic costs associated with the air pollution-related burden of disease correspond to about $1.7 trillion of lost output annually in OECD countries, $1.5 trillion in China, and $500 billion in India. Really compelling financial case to get involved in this space. Onto the health indicators. So you would have seen these numbers as well. This first number, 250,000 additional deaths per year between 2030 and 2050. This is the number that came out of WHO a few years ago. And in my opinion, and the opinion of many others, is in fact a bit low, because it really only considers a few diseases, doesn't include things like the impacts of famine or natural disasters or other climate-related impacts. I mean, we only need to look, no further than the current situation that's happening in the Sahel right now, in the ongoing famine, which may have millions of lives lost with this sort of direct climate implication. Then there are the emissions issues, stunting issues. 7.5 million children expected to be stunted by 2030. 4 million expected to be impacted by severe stunting. Malaria, food insecurity. These are real issues that we're dealing with now, and will increasingly deal with in the future. Moving on, country engagement. So only 15% of countries that have developed plans for climate change refer to health, and fewer yet have developed comprehensive multi-sector health and climate impact assessments. But we're trying to change that, and I'll talk about that in just a moment. Another study explores the NDCs, nationally determined contributions, the primary means by which countries have communicated the steps they're going to take to address climate change under the Paris Agreement. 184 NDCs analyzed, 66% or so include some mention of health. And of those that do, 75% do so in the context of adaptation, while only about 23% mention health in the context of mitigation. So this gives you a sense, I think, of how countries are thinking about this, what is important to them. And for many of these countries that have submitted their NDCs, it really is about adaptation. These poor countries that are being affected by climate change, they need resources to address this because they aren't polluting the same way that the developed countries are, yet they need the resources to respond and adapt and help their populations. So there are countries that are ready to engage in this space. We just need to be prepared with the knowledge and the resources to do so. So what are we doing? So we have developed over the past several years a World Bank action plan for climate change and health. And this includes institutional alignment, staff training, allocation of resources and areas of focus. It articulates a new 5-year strategy for World Bank climate change and health action, identifies discrete approaches for institutional concepts, establishes indicators, and ensures that this approach is mainstream and linked together to higher institutional aims. So all of this stuff's a bit boring, but really it's a fundamental part of the process to ensure that we are stitched up here internally so we can leverage the billions of dollars in resources that we have. And this report, as well as others that I will mention, are all available online, and I'll put a link in to the chat box below if you want to click on that and thumb through these and download them. What else are we doing? Well, we've identified areas of greatest geographic focus for health and climate, drawing on up-to-date literature and highlighting not only health and climate impact areas, but also those parts of the world that are suffering the greatest health impacts associated with the co-pollutants of emissions. And so this report it articulates where in the world these issues are greatest and identifies the entry points for us as an institution that's focused on country engagement, where we can go. This is our entry point for talking to governments. But it also establishes a methodology for understanding what is important where, while defining and parsing these differences between adaptation and mitigation approaches. The methodology can also be downscaled, so we can use it within countries to identify where within the boundaries of a country we should be working, what kinds of ecotypes are real hotspots for climate change and health, and how that should be considered within broader country frameworks. And then, most relevant to this webinar, we're working with partners like Healthcare Without Harm, thank you very much guys, to define this new field, or rather to make an old field better. So you've no doubt heard about climate smart agriculture and the tremendous momentum that's now behind this movement. Well, we're working to develop a similar strategy for health, and that is climate smart healthcare, really critically important. So the largest single area of World Bank health, nutrition, and population lending is cross-cutting health system strengthening. Almost exactly half of the World Bank Group's health commitments have been for improving health systems performance over the past decade, totaling nearly $12 billion. And so we've come up with this new plan. We want to make universal health coverage in our health lending climate smart. So this really means a few things. It means establishing systems for fair, efficient, sustainable financing of HNP outcomes that are adaptive to climate change. It means ensuring equitable access to affordable and quality health, nutrition, and population services that are also resilient to climate change. And it means leveraging climate smart interventions in other sectors, sanitation, water, agriculture, and so on, to strengthen our health sector results and generate really strong public goods. So our new collective strategy considers low carbon and resilient strategies together to reduce emissions of greenhouse gases through better and more active transport, through the implementation of more sustainable food and energy use to result in better nutrition and cleaner air and water quality, and designing and building, operating and investing in health systems and facilities that really generate minimal amounts of greenhouse gases, while also building resilience to climate shocks and to long-term climate changes. So what else? Well, we're working to pilot this in country. This doesn't mean anything if it isn't getting to our stakeholders and then the folks that are on the ground. So over the past several years, we've been working with Mozambique, exploring what's possible at this climate change and health interface. So we've developed a series of health preparedness response and recovery protocols. We've developed extreme weather protocols and action plans, and a climate change and health action plan for country. We've established a geospatial vulnerability analysis of climate change and health impacts. We've conducted a scoping analysis of potential health, climate, and other benefits associated with clean cooking interventions and the relationship there between climate change and health. And in addition to delivering this to the country of Mozambique, we've gotten this published in the peer-reviewed literature to make sure that our methods are both really sound, but then also to disseminate it in different spheres so others can build on this work. We also have a couple of upcoming projects. I've just gotten back from Madagascar myself, where I spent several weeks working with the government there to establish a climate change and health stress test. So we went in partnership with this new $60 million World Bank lending program in Madagascar, which was developed before these climate smart interventions were available. And now we're trying to find ways to link these to this project to make sure that this new investment is truly climate proof. And we consider the constellation of environmental and climate impact areas on health, nutrition, and population investments. And then secondly, we're about to embark upon a similar effort in Bangladesh, working with the health system there to make sure that World Bank lending is truly climate smart. So, not only do we want to know what the climate and health risks are, but we really are dedicated to putting money into stopping them. So we're also encouraging others in this space. We're working with dozens of partners to address climate change and health and are leveraging the expertise and organizations that have the know-how in specific climate and health areas. So for trainings, that means working with the WHO. For research, that means partnering with universities like LSHTM and Harvard and Wisconsin and many others. And then for building mitigation and resilience strategies for the health sector, that means working with Healthcare Without Harm. I don't want this to be an advertisement for Healthcare Without Harm, but these guys really have been great. They really know what they're doing in this space, and have helped us tremendously in the development of climate smarting World Bank health investments. But we're also aligning our efforts with other funders, with the Inter-American Development Bank, the Asian Development Bank, and the North Development Fund, sharing this information to stimulate action and response to ensure that these lessons have reach beyond our own funding institutions so they can be deployed in other parts of the world with other actors. We're not proprietary about this information, and we really want to ensure that the best lessons get out there so everyone can be saying climate smart healthcare. That can be the new norm. So in sum, the health impacts of climate change are well known and well characterized. I think you probably all know that. Responding to them and preventing further negative outcomes will require considerable integration across sector and within sector, though. And so I think that's really now where we need to focus. Secondly, funders are mobilizing. The development community, foundations, others, people are starting to think about this. I can't tell you how many meetings this year with aid organizations and with private sector foundations, where we're starting to think really critically about climate change and health and how we can tackle the collective problems together. And then thirdly, the health sector really must continue its leadership. There's been a tremendous amount of accomplishment over the past 25 years, but fundamentally it's not enough, and the momentum needs to pick up. Leaders in the health sector are authoritative, definitive, respected usually. The complicated pieces of the puzzle are in place, and now they just need to be arranged. Climate smart healthcare must become the norm. There may be a day where we don't have to use the term climate smart because it will be taken for granted that this is exactly what healthcare and health systems are. Unfortunately, that's not today. We need to ensure that this messaging is clear. We need to ensure that health systems are low carbon. We need to ensure that health systems are resilient. And collectively and together, we need to ensure that health systems and healthcare moving forward is climate smart. Thanks. And then here's a quick picture of the kids just to make everyone remember what this is all about. And they're adorable. There you
Thank you very much, Timothy Bouley, especially for your leadership within the World Bank, linking climate and health and advancing this new field of climate-smart healthcare. Let's now turn to Josh Karliner to talk more about the World Bank report and how it can be used in the field and on the ground in health facilities. Josh, welcome.
Thank you very much, Susan, and hello, everybody. Thank you, Timothy, for your excellent presentation, and we have very much appreciated the opportunity to work with the World Bank on this effort and look forward to continuing to collaborate with the bank as we build this effort for climate-smart healthcare. I want to talk a little bit today about the actual report, its origins, and what it covers to give you a bit of an overview of it. In the chat box, there's already a link to download it, so if you haven't downloaded the report and you want to, it is available from the World Bank website. My presentation takes as its point of departure the same place Timothy's presentation did, the Paris Treaty. We see the treaty, as many people do, as a framework for a transition to a low-carbon economy. It's perhaps not enough, but it is a really important start, and it's something that we are working off of. And the key now really is to implement this treaty. And the Climate Smart Healthcare Report is an effort to create a set of tools for the healthcare sector to begin to implement the Paris Treaty by moving toward low carbon and resilience strategies. And so the basic premise of the report, as Timothy sort of gave an overview of, is that investing in climate smart health systems can help address climate change, it can improve access to healthcare, and it can promote sustainable development. And I want to go through 6 different areas that the report covers today. So first of all, I want to talk a little bit about what it means that we've established this concept of climate smart healthcare. Second, I want to discuss a little bit how this report builds on the work that has been done by others, by the World Bank, by the WHO, by the Lancet, and Healthcare Without Harm's own work over the last several years. Third, I want to talk about the initial estimate of the health sector's carbon emissions that the report identifies. And fourth, I want to talk about the key elements in the Climate Smart Healthcare report and the key elements of Climate Smart Healthcare that we have identified as we've written this as a team of people. There were about 10 authors on this report. Fifth, I want to talk about the tools and resources for implementation that exist in the report. And sixth, the set of recommendations or options for ministries of health and development institutions that the report provides. So to get started here, let's talk a little bit about low carbon or mitigation and resilience. There is, in a sense, a false dichotomy out there in the climate discussion. Some people talk about mitigation, others talk about adaptation or resilience. And what we've done with coining the term climate smart healthcare, which actually Timothy, I want to give him credit for coining the term and bringing these two things together, is we've brought together the mitigation and adaptation components. And we've said these are not separate from each other, but in fact, they are part of the same, two sides of the same coin. And if we are going to be climate smart and if we are going to address climate change, we have to address both at the same time. And so you can see from this Venn diagram that Timothy also put up on the screen that there are significant overlaps between sustainability or mitigation strategies and resilience or adaptation strategies. And so there are many areas that, if they are implemented well, provide both adaptive capacity and mitigation. So energy and water efficiency, daylighting, natural ventilation, rainwater capture, solar sharing, and also health system straining and moving toward universal health coverage are all part of that overlap. So when we move toward addressing the health impacts of climate change, there are both low carbon and resilience strategies that can be implemented at the same time. And this is, of course, really important because really we're talking about when we're mobilizing the health sector, when the health sector mobilizes itself to address this issue, we're talking about preparing for the impacts of climate change, which the health sector is not that well prepared to address, preparing for the shifting burden of disease, preparing for the impacts of increased storms, floods, and droughts, while also reducing its own emissions and providing sustainable access to energy to power healthcare. And so all of this is part of this climate smart approach. And so that's, in a sense, one of the innovations of the report is to do something that in many ways is just plain old common sense, is to bring these together under one roof. So second, we're building on work that's already happened. So and that's been going on, and we're working with partners around the world to build on this. So the World Health Organization, for instance, has defined low carbon healthcare as a priority for health systems to be able to lead by example. The World Health Organization has also developed a framework for climate resilience for healthcare. Healthcare Without Harm, together with the U.S. National Institute for Environmental Health Sciences, has also developed a framework and a set of checklists for health hospitals and health systems to prepare for climate change and to develop greater resilience. This report builds off of that checklist and helps universalize it and make it applicable to other countries. The Lancet Commission has also created a framework where they have suggested in their 2015 report on health and climate change that by moving toward low-carbon health systems, healthcare can mitigate its own climate impact, become more climate resilient, and lead by example. In other words, climate-smart healthcare. So all of these important health institutions have developed a set of approaches around health and climate change that the healthcare sector can adapt, and that this report begins to consolidate into this overarching approach. Healthcare Without Harm itself has been working on health and climate change for a number of years, and we've mobilized the Global Green and Healthy Hospitals Network around climate change through the 2020 Healthcare Climate Challenge, which takes a climate-smart approach by using the Lancet's 3 components: mitigation, resilience, and leadership. And we have now more than 135 institutions representing more than 9,000 hospitals and health centers that are participating in this challenge, committing to carbon reduction, to resilience and leadership, and measuring their advances. So all of this report occurs in this context, and it builds off of this foundation to move the work forward. So my third point is that really very few countries have undertaken a comprehensive healthcare carbon footprint measurement. And what we found when we were writing this report and researching this report is that there's a significant amount of study that is still necessary to more comprehensively quantify healthcare's contribution to climate change. This report makes a first ever estimate of healthcare's global emissions. It builds off of, and I'm going to jump to the next slide here for a second, it builds off of what we already know. So we already know that healthcare in the U.S. contributes to almost 10% of my country's emissions. So the U.S., which is the greatest per capita and historical emitter of greenhouse gases, 10% of that comes from hospitals, health systems, and the healthcare supply chain. In Europe, the rough estimate is around 5%. We know that in the UK, the National Health Service is more than 25% of public sector emissions. And so we began to ask the question, well, what about a country like China? What about other developing countries? And what about the whole globe? And so jumping back to this other slide, we've basically pegged healthcare's carbon emissions at about 5% of global emissions, which means that it's about 2.6 billion metric tons if you accept that premise. That's a significant amount. It's not a small amount, which means there's a tremendous opportunity for hospitals and health systems around the world to address this issue and through climate smart healthcare to reduce carbon emissions and play a leadership role in addressing climate change. So how do we do this? Well, there's also been very little study done of what the footprint of healthcare is. There's been some study done by some individual hospitals and health systems in different countries. The most comprehensive study took place in the UK. Again, the National Health Service in the UK undertook that study and found that while there are significant emissions that are, in a sense, the low-hanging fruit that can be addressed through addressing energy consumption and implementing greater efficiency and moving toward renewable energy. So the building emissions in acute care facilities, which are the green bubbles there. And there are significant emissions that come from transport that surrounds a hospital. The the greatest source of emissions that they found was from procurement, from the supply chain. And so pharmaceuticals and medical devices make up the bulk of that. And so this is very important in terms of if we want to look toward a long-term strategy for climate-smart healthcare, we need to address the operations of our facilities, and we also need to address the supply chain and come up with a procurement strategy that moves us toward a low-carbon economy. And the other side of this coin is that healthcare can play a leading role in moving the world economy and that supply chain toward low-carbon strategies, because healthcare makes up 10% of world GDP. So if we can move the healthcare supply chain, we can have a significant impact beyond the hospital's wall in terms of production and consumption. Okay, so we estimated emissions from a number of different developing countries, looking at emissions as 3% of total emissions from those countries, and then potentially 5% of emissions from those total. And we came up with these figures, which again are not insignificant. Perhaps more importantly, we began to look at what would reductions in emissions from these countries look like. And if you look at the most conservative estimate, which is in the left-hand column here, 116 million metric tons from 25% reduction in healthcare emissions from the low emissions scenario. This would be equivalent to removing, if we were able to achieve just this very modest approach, because many hospitals and health systems are already moving toward carbon neutrality in many countries. We know much more than this is possible. But even this modest approach would be the equivalent of removing 24 million passenger vehicles from the road, or decommissioning 34 coal-fired power plants, or installing 29,000 wind turbines. So that kind of approach would protect health from the pollution that came from, for instance, those coal-fired power plants. And it would move the world toward a more comprehensive low-carbon approach. But just as important as reducing emissions from hospitals and health systems is that low-carbon healthcare is a health-strengthening strategy. It is a strategy to promote universal healthcare, in that by providing access to healthcare for health facilities that do not have, by providing access to energy for health facilities that do not have that access to energy, with low-carbon strategies such as renewable energy, solar, small-scale hydro, wind, we can help power healthcare and increase access to healthcare. And this is something that, a point that the World Health Organization has made a number of times. Access to healthcare can be enhanced and made more reliable through off-the-grid renewable energy systems. So this, again, is a resilience and a low-carbon strategy that can help move the agenda toward greater access to healthcare and toward universal healthcare. Okay, so the next point here is that there are a set of elements that we identified in this report that are the key elements toward for low-carbon healthcare. And I apologize, this is an old slide. You can see there's an old date up there, but here are the elements that we've identified. Overall system design. So health systems, if they're designed in a decentralized way and that are driven by public health needs, can reduce the need for large-scale facilities that are high-carbon facilities. And the basic premise here is protecting public health in the first place will reduce healthcare's emissions and reduce the need for carbon-intensive healthcare strategies. Building design and construction, renewable energy and energy efficiency, sustainable healthcare waste management, sustainable transport and water consumption policies, low-carbon procurement policies, and resilience strategies are the 7 key elements in the report that we've identified. In addition to these elements, we have provided in the report a set of charts and guidances and case studies that are tools and resources for the World Bank and World Bank staff, for World Bank clients, and we believe also for non-state actors, hospitals and health systems, GGHH members, municipalities and state health systems and provincial health systems that are addressing these issues. So you can see the list of charts and guidances here that we've developed that exist in the report, and one example on the right side of the slide of the type of resources that are available. So we hope that these resources will be used and will be useful to those implementing different policies around the world. Then we also developed a set of options for policies or policy recommendations, both for ministries of health and health systems. And you can see here, I'm not going to read the slide to you, but you can see that there are a set of options for policies to build climate smart approaches for health ministries and health systems. And then also a set of options or recommendations for development institutions of how not just the World Bank, but other multilateral aid agencies and bilateral aid agencies and other development institutions can begin to integrate climate smart strategies into their operations, into their strategies, into their policies, so as to leverage, as Timothy was talking about, the billions of development aid dollars that go to health and that go to climate to move them toward a climate smart healthcare approach. So in sum, we believe that there are significant benefits to climate smart healthcare. Climate smart healthcare will help reduce healthcare's carbon footprint. It will save health systems money while strengthening them. It will increase access to primary care in energy-poor settings. It will prepare health systems to become more resilient and adapt to climate change. And it can position health systems as leaders in responding to climate change in a broader cross-sectoral approach to the issue. As far as healthcare without harm and our next steps, we are committed to working with the World Bank and many of our other partners, including UNDP, including the members of GGHH, health ministries around the world, health sector partners in multiple countries to decarbonize the health sector, to build a set of new partnerships that will scale this work and actually move it in the direction of addressing the ambition that we have, which is to promote a carbon neutral healthcare sector around the world and to measure our progress in achieving these steps. So with that, I will pass the ball back to Susan Wilburn, who will give you a few more concrete examples with some snapshot case studies from the report. Thank you very much.
Thank you, Josh. Really engaging and interesting presentation. I'm going to now take you on a whirlwind tour of some of the case studies, but not all of the case studies that you'll find in this report of the World Bank. I will be doing this quickly so we have time for questions, and to let you know that you can find much more details of the Climate Smart Healthcare case studies in the report itself. You see, again, these 7 elements. I will be covering most, but not all of the 7 elements in the case studies, but there are case studies for all elements in the report. And when you look at the report, you'll see that they have been categorized by the type of intervention and color-coded by the region or country from where the case example of implementation has occurred. So starting with the African continent and a low-carbon building design, we're going to look at 3 different design strategies in 3 continents. This is in Rwanda, a facility that will be fossil-free by 2020. This hospital was constructed using all local materials and 100% local labor. The design group from Massachusetts worked together with the community to develop the capacity for labor to build the hospital with reduced energy consumption, and you can see some of the design elements that resulted in reduced energy consumption, natural ventilation in order to prevent nosocomial infections. The masonry was built partially below grade, which has also been done in Nigeria and other places to cool the facility naturally, and they have rainwater harvesting in this. Another low-carbon building design in India, in Mumbai, that was opened in 2009. This facility is LEED certified. That's leadership in energy and environmental design. It has low-energy lighting. It keeps its hot water with solar photovoltaics, harvests rainwater, treats its own sewage so it reduces water use, and has high-efficiency wall and window systems. Another design in another continent, in Buenos Aires, in Argentina, the Sanatorio Finichetto Hospital with thermal insulation in the walls, sunshades, and a ventilated facade system, geothermal exchange, heat exchangers, natural lighting, and rooftop gardens that are both healing gardens, as well as cooling for the facility. Here's another design in the same continent in Mexico City. This design at Torre de Especialidades is a health co-benefit design to reduce air pollution by removing smog from the surrounding air. This hospital, you can see the giant honeycomb that has a screen coated with titanium dioxide that converts smog into inert chemicals. It also blocks sunlight, so it reduces the cooling system needs. Thinking about retrofit of hospitals, this hospital, this health system in the Western Cape in South Africa, one of our very active members of the Global Green and Healthy Hospitals Network, has now eliminated coal and oil-fired boilers at almost all of its 53 hospitals. You can see the lighting changes they've made, and just in one hospital alone, Lintiger Hospital, in their laundry efficiency measures, they've saved 19 million liters of water, 550 metric tons of CO2, and saved $60,000 per annum in the process. Another retrofit, moving to the Asian continent in South Korea, the Yonsei University Health System, who is a part of the 2020 Healthcare Climate Challenge, and they have a goal to reduce their emissions by 30% by 2020. And you can see all of the retrofit activities that they engaged in to reduce their energy use and reduce their carbon footprint and become climate smart. Now, continuing in the Asian continent, in Nepal, we have low carbon waste management, where you can see the one before slide and then an after slide of our colleagues working with Healthcare Without Harm, the Healthcare Foundation of Nepal, that reduced the volume of their medical waste in half. They now recycle 1/2 of all of their waste, which produces income and supports their waste management program. They treat their infectious waste with autoclaves, and in a study that was done in the past year by our colleagues demonstrated that this is about 10% of the carbon footprint of healthcare waste incinerators. They also are producing biogas from vermicomposting, and with the support of the World Bank have installed 248 solar panels. Just one example of reduced carbon footprint from anesthetic gas management. As most of you know, anesthetic gases can be between 400 to 2,000 times the carbon footprint or equivalent of carbon. In this study, they found that 50% of their emissions were from anesthetic gas using nitrous oxide, which they reduced by 23%, and had a total emissions reduction of 41% in the 5-year period between 2007 and 2014. Others have targeted specifically desflurane, which is the highest carbon footprint of gas, to take it off the formulary, and there's case studies on our Green Hospitals website of those. Now looking at case studies where they're low carbon and resilient, here is a hospital that's in the Smart Hospitals Initiative in the Pan American Health Organization in the Americas, in the Caribbean, where they have regular hurricanes in almost every fall of the year. So they strengthened the roof, they added solar panels as part of the strengthened roof for electricity, and they reduced their energy consumption by 60% and made their facility more resilient in infrastructure in the case of climate instability and their hurricanes. Another example of resilience to power cuts is Hospital Gujaman Singh in Nepal, in a rural area, an off-grid area, where they have solar panels and batteries that provide all the power for the hospital, including for X-ray, for their waste autoclave, and in this way, when there is instability in the grid, which is most of the time in this setting, they can continue their operations. The last look at renewable energy is a hospital, Gunderson Health in the United States, which achieved energy independence in 2014, where they are producing more energy than they are using. They started that by having energy efficiency measures and had a 40% reduction in energy use. And then you can see the array of the types of renewable energy that is powering this healthcare facility, a leader across the U.S. just some summary of renewable energy opportunities in Africa, where 15% of the hospitals in Uganda are using solar to complement the grid. Sierra Leone, which had before this implementation, 90% of health facilities without any electricity, now have 36% of the facilities and 43% of hospitals using solar in combination. And the solar refrigerators pre-qualified by WHO for vaccine and blood storage. The last piece I want to talk about, and Josh already mentioned, the National Health Service in the UK and England. The National Health Service and Social Care Group together represent 39% of the public sector carbon footprint, of which 72% is procurement. One case example of Healthcare Without Harm's work together with the UN Development Program. We have a joint project on sustainable procurement with the goal to not only reduce the greenhouse gases in the supply chain, but also reduce the toxicity of the chemicals and materials in health products that are purchased by the UN and conserve resources such as water in manufacturing. And just a look at the outcomes of the first phase of this project, you can see we developed an engagement strategy with UN suppliers and an online platform and a list of chemicals of concern to phase out in procurement. This is the slide you saw that Josh showed, and I want to thank you all for your attention. I think we have a little bit of time for questions. If you haven't already asked your questions, continue to put them in the question and answer or the chat box. And I will start with a question for, we had a number of questions that came in during the session. The first question is, are there resources in the Climate Smart Healthcare Report to help us measure the carbon footprint of our particular clinic?
This is Josh. I guess I'll take that one. The quick answer is no, there are not. However, if you are a member of GGHH, you have access through GGHH Connect to a series of resources. And if you join the 2020 Healthcare Climate Challenge, there is a measurement tool on our Hippocrates data center that will allow you to measure your baseline, your carbon baseline, and then your progress in reducing your carbon footprint. And we will be rolling out in a few months a energy challenge that will have a much more detailed system for measuring healthcare energy use and then helping you convert that in terms of carbon emissions. So this report doesn't provide that. We have resources, and again, it's something we've identified together with the World Bank as an important piece for further study and research, and we would love to see a common framework around the world for healthcare to measure its emissions.
Thanks, Josh. Second question, is there already evidence that telemedicine can reduce carbon emissions? And I'll answer that. There is evidence from work done by one of our members, Kaiser Permanente, that has demonstrated quite an impact of telehealth and telemedicine and reducing carbon emissions. There is work in progress by the NHS England on changing care patterns, including providing additional access to health services through telehealth strategies. That is, we're looking forward to receiving the results of that work. Here's a question for Timothy. Can you tell us more about how the World Bank will use this document and what will be the impact on health development projects? Related question that maybe you can take both at the same time is, how can the listeners on this webinar and members of the Global Green and Healthy Hospitals Network bring the report to the attention of the health ministries and development agencies working in their countries?
Great, thank you. Yes, for the first one, we essentially we're using this as a blueprint. So as we are working with different health investment projects across the bank, there's a number of ways that we do that. So one, we review projects at the very earliest stages when they're just concept note. and then that moves to project appraisal document phase, which is a much longer document that articulates precisely what the health investment is going to be. And so we're trying to draw the lessons that are presented in this document and embed them within World Bank health lending. And those projects can be anywhere from a few $1,000,000 up to a few $100 million. And so there's tremendous potential to leverage climate smart healthcare across our portfolio of health lending. Separately, we are going around the world and we're starting to conduct these climate change and health stress tests where we're looking at systems. And as projects are already in process, we're trying to help them understand where there are interventions that can be made to improve them for their subsequent phases. So again, sort of both starting at the very beginning and then projects in development and review phase, applying the lessons learned. In terms of how you can use this report to get some awareness for this and for these methods and approaches, I mean, absolutely, just start talking about this. I mean, I can't say enough. Just say climate smart healthcare. Put it on your webpage, just put in your blogs, link to the World Bank, tweet at us. All of these sort of have higher level political value. I can't tell you how seriously tweets in media directed at the World Bank is taken. The communications folks in our department sort of sit right next to the senior management. And so when the World Bank is mentioned in something, those mentions are taken very seriously. And then that in turn stimulates a process where we get the specialists involved and we get country folks involved. And then there's dialogue that happens between management of climate department and health department, and then also country management units. And then as a result, interactions with health ministries and governments there too. Or similarly, if you have interactions with the government, say, look, this is this new thing, by all means, ask the World Bank for funding climate smart healthcare and interventions and reference this, because the folks that are in the field don't always have these kinds of resources at hand. We do our best, but it's good to hear from the outside as well.
That's great. So all of you bloggers and tweeters out there, Climate Smart Healthcare at World Bank, and it may help advance this new initiative and new era to address the impact of climate change on health. Why do you think it is that health is receiving so little, health and climate are receiving so little of the funding? And related to this question, you mentioned that the analysis of health in particular countries related to climate in the nationally determined contributions showed a lot of health in developing countries, but no proportion of health in North America, U.S., Canada, Australia, and Europe. Why do you think that is?
Yeah, great questions. So on the first question, why is health not receiving very much funding to tackle climate change health interactions? And I think that there's a couple of reasons for that. One is that the folks that are working in the health space aren't used to working within the framework for broader climate finance. And then secondly, and I'll describe that in just a bit, and then secondly, that the climate finance frameworks are similarly not really teed up to lending or granting to health systems. So there are all these major funds out there and smaller funds that are dedicated for climate finance, but they don't have health articulated as a window for finance and funding. That doesn't mean that organizations and governments that are focused on health can't apply to them. They just need to frame and reshape their applications in a way that they can get those resources. So one of the things that we're trying to do this year is to develop a guidance note for folks working in the sector to access climate finance, because there are windows. The WHO is trying to get accredited with the Green Climate Fund. The Global Environment Facility is beginning to work on health and climate. And so resources will be available. It's just about linking that up. And then secondly, why is health and climate more linked up in developing countries? And I think that's simply because the health ministries in developing countries are more acutely aware of the impacts of climate change on their health systems and on their populations. In developed countries, there's a chasm that exists between health systems and environment systems and agricultural systems and so on, but in smaller governments where the interactions between health and environment are really quite salient, it is a priority for the folks working on health investment and health governance.
Another question is, how expensive are the design and retrofit interventions to implement, and how long will it take for a hospital to receive a return on investment? Do either you want to take that question, or should I?
Why don't you go ahead and start, Susan?
Okay.
Unless Timmy wants to.
The return on investment for design is sometimes more quick than retrofit, but the first, as we saw in many of these case examples, if you start with energy efficiency measures inside the hospital, including behavioral measures, one can save 40% of their energy use and save money without spending any money at all. In terms of combined heat and power, which is will save about 25 to 30% of energy use. In the UK, one case example of an NHS Trust hospital in London, they had a return on investment of that installation in 10 years, but that return on investment is just the cost of energy. It does not include any of the health co-benefits or the reductions to the cost in the health system for the savings from the health impacts of climate. Other kinds of activities and retrofits have a 1 to 3 year return on investment, and they cost between, in terms of the major energy installations like combined heat and power or heat pumps, from $250,000 to $10 million, and again about a 3 to 10 year return on investment just from energy savings alone. You can see the slide that gives information about how to become a member of the Global Green and Healthy Hospitals Network. As Josh said, there are many resources for measuring and monitoring your carbon footprint and greenhouse gases in your healthcare facility. And last, I want to remind you that you'll be receiving in your server an evaluation. We take the evaluations to heart. Please let us know what we did well and can improve, as well as any ideas you have for additional webinars. The next webinar in our series is coming up at the end of August when the Minamata Convention on Mercury comes into force. That will occur on the 16th of August, and in our webinar about the implementation of Minamata, which is required in all healthcare facilities by 2020, will occur on the 30th of August. So I thank you all. I want to thank Timothy Bouley, Josh Karliner again, and all of you for joining us today. Have a great evening.